Thank you, Florent. Next, I'd like to invite Dr. Emperor, the Global Fund TB Grant Program Management Unit Lead at Nigeria's National Tuberculosis and Leprosy Control Program. Dr. Emperor today will be discussing the integration of AI-enabled X-ray in TB screening in Nigeria. Dr. Emperor, the floor is yours.
Okay, good afternoon, everybody, and thank you for having me today. My name is Emperor. I work with National TB Program in Nigeria. So I will be talking on the X-ray, how we have been using X-ray as a country in trying to address TB challenges in our TB intervention. Next slide, please. Next slide. Okay, you are aware that Nigeria is among the 6 high-burden countries and first in Africa, and our case, we contribute about 4.5% of the TB case notification in the country, in the world, and among the TB incidents. Our knowledge about TB among people is very low and very poor, and then that shows that even among the healthcare workers, we have about 24% knowledge gap. People who are aware of TB intervention are very limited. Our TB coverage over the period has improved in the past few years from where it is today to 74% to 74%. And then that has given us a good result as a country. And then we also have reduced our mortality rates. However, one key thing that is very important to know is that a lot of household incurred cost, which is regarded as a catastrophic cost, is still about 71%. Next slide. It's anticipated that about in Nigeria that 219 per 100,000 population is expected to have TB. And based on that, if you calculate based on our current population, we have about 499,000 TB cases anticipated to be detected in Nigeria. Next slide. However, since 2019, the National TB Program took over as the grant managers. And after taking over as the grant manager for Global Fund Grant, a lot of innovations were initiated to address the gap in TB. And based on that, that has led to a significant increase in TB case finding. Since 2018, you can see an upward increase in TB case finding in Nigeria. As of today, 2023, the last count for the year, we have 371,000 TB cases in Nigeria. So the country has been performing very well in the area of case detection. Next slide. However, even with the performance of the country, you can still see that the country is still having so much gap. If you calculate based on what is present, you can see we still have about 24% gap based on our estimated case, our estimated burden. And although this gap is being narrowed, however, as you can see that the gap has accumulated over the years. So the question still remains, are we detecting the old gaps, or are we cleaning up the old gap? But if you look at this, you can see that there is still huge gap if we can do some issues to address the old and the new gap, then we will know what is the actual burden. And that has initiated that the country is planning to do a survey to know what should be their current estimate of TB case finding in Nigeria, because using the estimated one, it will look here as if we are doing very well. However, bearing in mind that over the past 10, 15 years, we have also not been closing gap. We have maintained 24% case notification in the past 10, 15 years. And then It is important to know what should be the actual burden of TB in Nigeria as of today. Next slide. Another thing that we have noticed in Nigeria, even though that we have about the huge gap, is also in my country, is that we are looking at the number of people diagnosed with that are bacteriologically diagnosed. You can see if you check other countries that are actually closing the gap, there is also always this area where clinically diagnosed cases are very important. But if you notice, majority of the states in the country are actually diagnosing and placing patients on treatment based on laboratory findings mainly. So even though we are increasing in case notification, our clinically diagnosed cases are still very minimal. You can see in the slide that overall clinical case diagnosed in the country as of 2023 is about 18%. Which is a huge also issue that needs to be addressed as a country. Next slide. Childhood TB, we know that it's difficult to diagnose TB in children, but I tell you, although we are doing well, but you shall see over the years, we have been doing less than 10% in the years, and some years even 6% before we climb to 10%. I'll tell you, it is with the innovation of X-ray in people, especially children above 6, are actually what has been helping to increase our childhood diagnosis. Because of that, if you look at our data in a disaggregated manner, you notice that the children below the age of 5 are still very minimal, that we're only seeing those who are above 6, and these are the children who are actually having access to X-ray mainly. Next slide. This is just to buttress how much most of the states are doing in childhood contribution. Next slide. Okay, so with all these reasons, we can ask ourselves, why is it that we want to invest in X-ray? Because a lot of innovations are case findings going, community interventions, all those things are going. Then the question is that how do we meet the 2030 target of the global TB target? And the only way we can do it is to bring in some new innovations that are just being produced and also help in case notification in country. So one of the things that we have looked into as a country when we did analysis on why we need X-ray was that our cases are still low, even though we are closing the gap, but we still need to do more. Low case finding among children, the clinically diagnosed are still very limited. Early and improved screening in the health facilities and communities are required, because one of the findings when we did our survey was that in the first survey we did more than 12 years ago, showed one thing very significant, that most of the TB cases were identified and were diagnosed were gotten through X-ray during that survey. It was through X-ray that most of them were able to be identified and were screened. So even though people may not present with clinical symptoms, often the way it's expected of 2 weeks or more, however, X-ray was able to identify them and they were able to be screened and found. And that was how some of the cases were found during the survey. So if you actually want to get TB cases early and reduce the transmission in the community, we actually need to start screening early, our community and in our facilities very early. Improve the quality of the screening, and also because of high symptomatic area people, we need to involve a system that will also help us to identify those silent cases of TB in our community. Next slide. So one of the things that started in Nigeria, if you look at the first presentation, this is a well-known intervention and was initiated through USAID intervention that time, which was called Wellness on Wheel. And people in a short form call it Wow Keke. And why do they call it Wow? That's Wellness on Wheel. But what Wellness on Wheel was the first truck that was produced with Delft imaging and has solar systems and also diagnostic capacity, which is taken to the communities, and based on that they are screened. This was initiated by USAID intervention in 2017, and this truck was well designed, and then everything was going on. Cases were being found. It was the first X-ray we got in country by the program that has a Cat4 TB software, which helps in giving you a profile of the patient and gives you the score that will help you to indicate whether the patient is supposed to go for a screening test. This was actually procured like two bars at that time, but later on, we were able to procure more for Lagos State. During COVID, Kaduna State procured almost 5 additional vehicles of this kind of intervention to enable them not
There seems to be some issue with the internet. Just give Dr. Emperor a minute. He's going to continue in a bit. Thank you.
Hello, can you hear me?
Yeah, hello, Dr. Emperor. Yes, we can hear you now. Please continue.
Oh,
thank you.
Thank you. Okay. So, like I said, the awareness on wheels was actually the initial intervention, where we have the Delft digital Delft X-ray that has a Cat4 reading, and also have a gene expert in the truck, which is taken to the communities and some high burden facilities for screening. Next slide. Next slide. So from there, having that first experience, we were lucky to have announced that we have announced that we have another one, a portable digital X-ray, which has an AI that can be used, and also USID was also on board to procure that time for the IPs working under the USID. KNCB procured 7, IHBM was meant to procure 3. And based on that, they started the use. But with the innovations and the results coming out from these X-rays that were procured then, the Delft digital X-ray was procured then. It was actually, we have gone to procure more from different angles. You can see at the list that currently we have about 73 digital X-rays in country that has AI. And this is to accentuate the importance of this X-ray as a program, because with this innovation, the case finding has actually rapidly increased, especially at the community level. Next slide. Next slide. So if you look at, I just want to show a trend of the initial diagnostic. You can notice that have been identified since 2021 in 2000. These are the records by the National TB Program. There are some areas that may not be present in this record, but to show you that record shows that we show you the number of cases that have been identified in that. And because of it, there was a lot of innovations that were ongoing. One of the innovations was when we now moved from wellness on wheel to wellness on keke. Keke is a tricycle, but in this tricycle, you now see the mobile digital X-rays and also maybe another molecular testing tool inside that keke. Why? People may say, why do we go through this innovation? It was based on the reason that we found out that some of the areas that were bad roads, that were rocky areas, that this big van may not be able to penetrate or move through, that we were able to find out that the motorable parts ways to reach out for those services to increase our universal access to care is through the use of this tricycle. And that was an innovative process by the KNCV using USID funding to support this. Next slide. We moved on to other innovations as a country, because as a country, like we moved on in innovation, we were looking for the faster ways to report what was coming, at least to make more clinical diagnosis. So those tests which were not positive after they were identified as presumptive, was made to where the KNCV, through their support and their collateral partners, were able to be using what we call in country an XMAP, which helps us to have a radiographer that we read all the X-rays that are now negative, but suspected to have high score. So all those high score X-rays that the sputum sample were shown to be negative are now read through the XMAP, which gives you the immediate results, and also within less than 24 hours, the patient is placed on treatment because the results will come out quickly. And the radiologists read this at the comfort of their homes through this app. Next slide. So one of the key innovations that also have been with the mobile digital X-ray, which has actually changed the story, especially as it relates to private sector, is the ability of it to identify other diseases, cardiovascular diseases in the process. And this process was one of the innovative interventions in one of the states, which is going to be presented in the Union Conference this year. And one of the exciting things is that this longer makes it that this PDX is no longer just a TB alone tool. It can be seen an integrated service system for as every other medical service tool that's out there in the field. So instead of sometimes during this discussion of integration is also a very good way to sell the tool, to say that now is no longer going to talk about only TB. It has the opportunity to identify other disease areas. Like what we do now, all the disease areas identified, you are going to see that, for instance, all the disease areas identified, they are going to transfer them to a hospital where they can have access to care if it's not TB. Next slide. Next slide. Hello, next slide. So in line with our experience, we have also developed the following: integrated service delivery system, consider key populations, consistent monitoring of implementation for future implementation, and also for adjustment of our score, monitoring tool for the maintenance, link to all the in-country support systems to establish current brands for regular support. At least there's in-country support. Delft has an in-country support system. Anything that happens in any of the machines, anything, we have somebody to call. You don't need to wait for the main office to get everything resolved. And all the stakeholders are now involved in the use of the X-ray, because we are no longer making it the web. What's important is that through Global Fund and through this thing, we were able to discuss, and Global Fund is procuring more than up to 370 portable digital X-ray for Nigeria with AI. And this is going to be a game changer for the country case finding.
Thank you, Katia. Good afternoon, everyone.
Next slide. Thank you so much. I think overall, the most important thing is that Nigeria is moving into a direction where we are going to be one of the biggest countries that are using this portable digital X-ray, and it actually has done very well for us. We were able to see the package. Many of the deaf X-rays that are coming, of the portable digital X-rays that are coming in, are actually going to be very useful to the whole system, and also going to be used for other disease entities in the country. We hope that with this, we'll be able to reach our target for 2030 TB elimination plan, which is very important for Nigeria, because control TB in Nigeria, I think you have control TB in most of especially in Africa. Thank you so much.
Thank you so much, Dr. Emperor. Nigeria's efforts in using innovative tools and solutions to not just scale up their TB screening efforts, but also strengthen their national healthcare system is something that's truly commendable.